Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show here on Friday. It's been a very busy week, so we're going to get right to it. We're going to have Dr. Raul Perez-Vazquez, internal medicine, on the program this evening until 6 o'clock. So if you have any calls and they're appropriate, you know where to reach us, 1-888-565-1470, or on All County Healthcare INC's Facebook Live page as well. Dr. Perez-Vazquez is an internist. I didn't know that term until about 5-6 years ago, but that stands for internal medicine. So in the business, they call them internists. We're going to talk a little bit tonight about antidepressants, diet as well, and keeping healthy and heart healthy. And learn a new term that I didn't know, STIs, the acronym. I know about the term STDs because I've seen that term over the years, but I didn't know that there's sexually transmitted infections. So that's a little different term that we haven't talked about. So tonight, as always, you can always see the shows on allcountyhealthcare.com, or like I said, on Facebook Live, which I always go and share right at the beginning, because sometimes we get questions there as well. So All County Healthcare INC's Facebook Live page. So without further ado, I want to welcome back to the program. I think this is your fourth time here on WNN 95.3 M 1470 AM. So welcome back, Dr. Perez-Vazquez.
Thank you, David.
Thank you. And I know you're very busy primary care doctor. Internal medicine's considered primary care, right?
Yes, we can switch back and forth.
Yeah, you can.
The hospital and the office.
You're the whole body. Yeah, you do rounds at West Boca Medical Center?
Not anymore. The office got quite busy, so I had to dedicate my time. I couldn't organize it to have a rotating schedule, so just stuck to the office right now.
And you, when I met you, you were over in front of West Boca Medical Center campus, but since then you've changed offices and you're on Kimberly Boulevard, is that correct?
That's correct, yes. Right in front of Century Village there.
Okay. Right, West Boca there as well.
Right.
And I'm going to share this on Facebook as well. I always do that. We sometimes get a lot of watchers on Facebook, so that's something that has changed over the years. Now, I wanted to have you on the program. New York Times, as you know, great journalistic institution. I'm always reading it when I can find it online. I know it's $7 on Sunday now in the grocery store, but people buy them. Yeah. I mean, it's wild. But you actually sent me an article I was asking you about. Now, it was on antidepressants, and it's called, it's titled, "Many People Taking Antidepressants Discover They Cannot Quit." Now, I always think of opiates as being very addictive, but this story, which is amazing, talks a little bit about antidepressants and kind of coming off of them at points. Now, I know as primary care, you are able to prescribe antidepressants. So tell us a little bit about what antidepressants are used for. I think we all think, depression first thing, but anxiety as well?
Yes, that's correct.
Okay. And when should someone seek a doctor's care to maybe have that conversation?
Well, the main thing is if any feelings of, for example, anxiety, physical manifestations of anxiety, like chest pressures, palpitations, anything uncomfortable, symptoms associated to depression, like withdrawal from those around you, overwhelming feelings of sadness, loss of interest or pleasure in activities that you would normally enjoy doing. So again, symptoms or feelings that spill over into your day-to-day function. If that's happening, then you should seek help. Absolutely. So that again we can try to make the diagnosis and begin appropriate treatment, so that you can carry about your day-to-day functions and continue with your interpersonal relationships and work and these kind of
and quality of life as well.
Quality of life is very important. Absolutely.
Now, is there a checklist that internists go over when they're talking to someone maybe about going this route. I mean, I know, like when you're talking about heart health, you talk a little bit about the Mediterranean diet. Is there a checklist as well for antidepressants that a physician may use?
Well, specifically for diagnosing depression, there are certain tools, not only screening tools, but also certain diagnostic tools that we use not only to, again, diagnose, but also monitor the therapeutic effects or benefits of the medication once the patient is well within treatment. So yes, we do. There are the tools that we use to monitor therapy, but also to diagnose.
And I was asking you in the green room as we were coming in, have a little conversation. There is different milligrams that antidepressants are available in, and that's important because even like the viewers and listeners have seen me. I'm a pretty big guy, you know, surprise size of an NFL defensive lineman in some aspects. I mean, I don't look like one anymore, but saying that these antidepressant prescriptions can kind of hit people differently. Like, even though I'm a big guy, it doesn't mean that I need a high milligram. And I was a little taken back by that because I always thought, like, well, if you're bigger, you probably need more, and if you're smaller, you probably need less. But that's not the case?
No, that's not. And actually, that as we were talking, that's one of the reasons why we always, these medications, we start off at the lowest dose to, again, monitor for side effects. And a general principle, not only with antidepressants, but with medications in general, we should always use the lowest effective dose. So as to, again, minimize side effects and then optimize the therapeutic effects with, again, the less dose possible. And which, again, we were talking about, and as part of the scope of this talk today was also it makes things easier, or makes it easier as well to taper off and eventually discontinue the medication when that time comes. That's
a good point, because I know obviously the lower the milligram, the less of that the potency that it affects the body with. Now, antidepressants, there's been so much talk about opiates, but antidepressants are obviously a different category. How are they different from kind of what's being talked about? Like, where, I guess my question is, where do they impact the brain? Are there brain receptors that these antidepressants go to?
Yep. So the SSRIs, which are the most commonly used medications, not only because overall they have a favorable side effect profile, but also because they are found to be quite effective as well. They act by preventing the reabsorption of serotonin. So serotonin gets released, from neuron to neuron. And again, serotonin is a neurotransmitter that provides, again, a sense of well-being generally. Has other effects, but these medications specifically prevent that reabsorption. So you have a lingering effect of serotonin. However, they do not necessarily act solely by this process. They downstream in the neuron per se, a lot of biochemical changes take place over time. That's why these medications, you don't see an immediate effect. They take sometimes up to 2 months to act. And again, because those changes take place over a prolonged period of time, once you stop that process, then these certain pathways in the brain have already been altered. So you really have to go slow and allow the brain to readjust to the absence of the medication. This is why all these side effects or withdrawal symptoms rather come about, and makes it really, really hard. Particularly because you taper down once the patient is off of the medication. They start developing a lot of these symptoms like fatigue, anxiety, palpitations, which a lot of times can be confused by just the presence of an anxiety state or a depressive state, when it really isn't that. So what we end up doing is says, oh, they're still anxious, they're still depressed. They're still having this, so we put them back on the medication, rather than thinking this is why the New York Times article was so good is because it brings us to the realization that yes, these are associated with quite a bit of withdrawal syndrome, and maybe we should, instead of looking at continuing therapy, maybe we should institute more effective ways of tapering and bringing down and eventually discontinuing the medication.
Thank you for explaining the SRIs, because I think that is a key concept in having a patient or an individual understand as well. We're here with Dr. Raul Perez-Vazquez. He's an internist, internal medicine, primary care in Boca Raton. Oh, right here in Boca Raton. That's great. You're actually bilingual English and Spanish, so that's great as well. 9080 Kimberly Boulevard, Suite 6, Boca Raton. I've actually been there. There's a lot of parking out front. It's a really good plaza. Definitely check him out, 561-477-7761. And he has his own website profile, drraulperezvazquez.com. So, or you can check him out, Tenant Florida Physician Services. It's tfpsdocs.com. I'm going to continue the antidepressant talk a little bit more. Now, what are some side effects? Because I know antidepressants, once you're on the one that works for you, can be very helpful in getting off of, getting away from depression, anxiety, and sometimes, obviously, all the time, you should work with a doctor, primary care, to, work on, if possible, to lowering that milligram and maybe coming off at one point or another. But let's talk about some of the side effects. Can it cause weight gain, fatigue, confusion, dizziness, withdrawal? Because I think that's what that New York Times article kind of got to, and that is coming off if you're on too high of a milligram can be really tough, and that can affect quality of life.
Right. Is it when what the Times article talks about is a lot of times these medications initially, and they do show a great deal of promise. I mean, there's a lot of, actually, the Lancet just put out an article these past couple of days showing the overall effectiveness. It was analysis of all the randomized controls trials that were done up to now, and there is a benefit over placebo of a lot of these medications. Yes, they do have a lot of side effects, but in general, if the side effects are present, then the risks outweigh any kind of potential benefit, particularly when treating depression. I mean, you certainly don't want to add something like fatigue or anxiety or some of the other palpitations, insomnia. All could be side effects of these. So those would be obviously counterproductive towards a healing of a depression or depressive episode. So if side effects appear, then yes, that's a medication you want to change, and you can change from one SSRI or one SNRI, which is a selective serotonin and norepinephrine inhibitor, which is another class of antidepressants that sometimes we have in our arsenal to treat depression. But you can switch classes. You can bring down the doses. Again, these changes can be made. For tapering fluoxetine or Prozac, because of its long duration of action, a lot of times a technique that we can use to safely taper off, minimizing withdrawal symptoms, is to switch over to Prozac if you're on another antidepressant, and then thereby taper the fluoxetine or the Prozac, taking advantage of its very long duration of action. Among other techniques that we can use to safely bring you down.
Definitely. Now, we're going to take a quick commercial break. On the other side, I want to ask you a little bit about benzos, and I'll have you give the medical term because I won't. Is it benzodiazepines?
Diazepines.
Okay. Thank you for helping me on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 20099096.
How to Stay Healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back with Dr. Raul Perez-Vazquez, internal medicine, Tenet Florida Physician Services, right here in Boca Raton. One more question, because I wanted to ask you a little bit about benzos, because that New York Times article we were referencing talks a little bit that as well. And I got to admit that I don't know much about them. I was completely wrong. I thought they were in the same category of the drugs that we were just taking, but I just Googled it, and they're different.
Yes.
They're a little more heavy hitters, no?
Yeah, I mean, they do have the role in treating depression and anxiety, mainly because they're fast acting, which is something that the SSRIs and a lot of the other antidepressants are not. So if you have somebody with a lot of disabling symptoms coming into the office, then benzodiazepines such as Xanax, Ativan or lorazepam, Klonopin or clonazepam, all those have an immediate effect and are used to treat or ameliorate a lot of these symptoms while the SSRIs kick in. However, what's important is that at that time we take away the benzodiazepines, because long term the benefits dwindle and you're left with a great deal of risks, of which potentially life-threatening withdrawal syndrome, which can lead to seizures and hospitalizations if it discontinued abruptly. Physical and psychological dependence is also a major problem. I have so many patients that have been on these medications for a long period of time for X or Y reason, and we've gotten to the point where we're off, but they ask me for the prescription just so they can have it there. And they say, "Doc, all I need is to know that the pill is there in case I need it.
Case of emergency break glass kind of
I haven't used it
thing."
in months, but I need to know it's there. And that is a classic example of psychological dependence. We certainly don't want to feed into that.
Yeah.
So, and again, now you start talking about there's also evidence about a 30 to 40% increased risk of developing Alzheimer's with long-term use on these medications. So again, the longer that you're on them, the more potential for side effects, and again, benefits dwindle, and that's not a good thing.
I know we talked about this in the past on the program. What can we do as individuals to just stay out of this whole discussion? Does exercise really make the body feel that much better that we can maybe stay away from benzos or antidepressants?
Yes, I mean not entirely.
Not entirely.
Depression.
But for the most part, over a length of time,
it will inevitably help you out.
Okay.
I have a lot of patients that actually manage a lot of their anxiety, their stress through exercise. I have some that exercise a lot and they still have a great deal of anxiety and depression. It all there's depression is multifactorial, but absolutely exercise and healthy lifestyle will inevitably have a positive impact and nothing else. So it is greatly encouraged as a cornerstone to treatment of depression and anxiety and a lot of these other behavioral health problems.
That's going to segue perfect into the next topic I want to talk a little bit about is diet and the heart as well. Now, but I do want to make one quick point. Go see your primary care on a regular basis a few times a year if you have any questions, because they're educated and trained. And as you know on this program, we have great doctors in South Florida. We've had about 200 on this program in 2 years. So if you don't go see Dr. Perez-Vazquez, which I think you should, go see any primary care when talking about these topics. I want to ask you a little bit about diet now. We always see on the commercials, go talk to your doctor before starting this weight loss program or doing this or that. Why is it important to talk to a primary care doctor before getting started on diet, and how can you help people with the plan that's best for them? Because every case is different, just like antidepressants, right?
Right. Now, with regards to diet, I mean, there is general consensus that certain diets are better than others. And again, you know, specifically speaking, I mean, the diet that always comes on top is the Mediterranean diet, with its little offshoot there, the DASH diet, which is specifically designed from the Mediterranean diet for patients with high blood pressure. And you know, the studies that it was formed, you know, along those lines showed a decrease of about 10 to 15 points on your blood pressure by just following the diet alone.
Wow.
So the Mediterranean diet, again, when you talk about evidence, the Mediterranean diet is the one with the most evidence with regards to its benefits, from cardiovascular risk reduction, reduction in cognitive impairment later on in life, cancer reduction, and even diabetes risk reduction as well. So again, the benefits are great. Now, you should talk to your primary care, absolutely, to help guide you through this and for certain monitoring, establishing goals, and help you out. But with regards to diet, I mean, it is very personal because, you know, it boils down to habits a lot of times. You know, diet a lot of times is just about bad habits. You know, I have a lot of patients, you know, because of work or anything, and I'm included sometimes in this. You know, we skip lunch and then you go to the next meal, and your brain is craving, you know, carbs and all these high caloric meals because you've starved yourself, and then you go and overindulge. You know, so that's not necessarily. That's just a bad habit that sometimes we can correct and achieve weight reduction, for example. But in general, again, that's one reason why I like the Mediterranean diet, because it's more of a guide as to what you should be eating, and it's much more malleable, if you will, to an individual's personal preferences and lifestyle.
And that's a lot of olive oil, a lot of it's a fish-based diet, white fish, and then obviously the more plant-based you can get, the better.
Yes,
because we all started eating plant-based in the first place.
Right.
So.
Yeah. With regards to proportions, I mean, definitely fruits and vegetables should be, at least according to the Mediterranean diet, at least 50% of your plate. 1/4 being proteins, with which you know, you can get from fish, chicken. You know, pork is in there. Obviously, certain cuts of pork are leaner than others, but definitely a reduction in red meats to about once or twice per month. You know, so and then your carbs, which should generally be complex carbohydrates. You know, it's your whole wheat, whole grains, and those obviously have much better health effects.
And in moderation too.
And in moderation, obviously.
And you practice what you preach. You must have lost 25 pounds in the last few years. You've kept it off though. I could show you a picture of when last time you were on. I can tell right now.
No, you know, it's hard, you know, to sit there and tell patients and listen to yourself every day, you know, saying the same thing, and then you get home and you really want to, you know, pick out, and you're like, well, you know, what I just tell, you know, these 10, 15 people, you know.
But your wife's a physician too, and she's in really good shape too as well.
Yes.
I pass her walking on the sidewalk about once a week on my way to the get lunch. But you're doing something, you know, right? You practice what you preach, and I think that's important. A lot of doctors do, but that's good to know, because it's much more believable when we see that you're keeping it off. Definitely. We have a few more minutes. I want to get into this STIs. I didn't know that term existed, and I've been in medical field for 6 years writing about. Is that different than STDs?
Well,
the same kind of.
I mean, I think the change is because it's more specific to the conditions that are at hand. Okay. I mean, when you think about sexually transmitted, they're not. Disease is more of a broad term. The majority of these conditions are actually infections from bacteria and viruses. You know, so that allows that specificity to what we're actually treating.
Definitely, we've had the wrong acronym. It is an infection, like you said, that could turn to a disease like AIDS or yeah, I get it now. I'm glad I mean, that's something I learned just right here, right now. So we're lucky to have the greatest doctors, and like I said, in my opinion, in the world right here on the How to Stay Healthy show.
Well, thank you.
And Tuesdays 6 to 7 on the You and Your Doctor show. We got 2 shows now, doing pretty good. Let me ask you a question I always wonder about. I didn't see a lot of doctors from age 12 to 35, to be honest with you. I always wondered the last 5 years, what are you listening to when you listen to people's chest? Are you listening to for irregular heartbeats? Are you listening for maybe atrial fibrillation? Well, atrial fibrillation is a regular heartbeat, but what are you listening to when you ask us to breathe in heavy and listen to the heart? What's a primary care physician?
If we're talking about like anterior chest auscultation.
Yeah, the general checkup when I go see you for a general checkup.
So breathing heavy is mainly for the lungs, and really is just to accentuate, the lung sounds. Taking into consideration a short period of time that you have to examine. I had a lot of attendings in residency that said, "No, you shouldn't ask them to breathe deep." But it does help. So. But in the anterior, in the auscultation of the heart, I mean, in the short period of time, there's a lot that you're listening to. You have, four major foci, each one corresponding to a different valve in the heart. It is essentially where the sound is transmitted to. That and variations with respirations and other maneuvers that we do to try to, again, accentuate and identify different problems from the heart in a gist.
I just thought I'd ask that because I think people listening and viewing, I think that's what we want to know. I mean, because it happens every time. And obviously we know what the blood pressure, the physician assistant or medical assistant takes the blood pressure and then briefs you when they walk out of the room. But you mentioned residency. Where did you do your residency? You were all the way up in Detroit, Michigan?
Detroit, yes.
Wow, yes. Wayne State Detroit Medical Center.
State, yes.
And internship there as well. And then you went to medical school
in Guadalajara, in Mexico.
Oh wow. Okay, neat. And I know we only have a minute. I'm going to use this time tell you a little bit more about Dr. Perez-Vazquez. Numbers 561-477-7761. Look him up online, tfpsdocs.com. He's got a location right here. Like I said, I've been there, easy to get in and out of, a lot of parking. That's always important. 9080 Kimberly Boulevard, Suite 6 in Boca Raton. I thank you so much for coming over on a Friday. I know you have busy weeks, so I'm glad this worked out because you've been on the show 4 times. You're a friend of the show. You're always welcome. And if you ever want to come on, just let me know, and we'll get the word out.
It's been a pleasure.
Thank you. And we'll see you Tuesday night here at 6 p.m. on the You and Your Doctor show. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those